Hi everybody, I am Dr. Pradeep Shenoy, consultant rheumatologist, addressing you from Amrita Center for Rheumatic Diseases, which is located opposite to KMC Tower in Mangalore. If you are having high serum uric acid levels and no gouty arthritis, and if you are wondering how to manage this condition, let us look into this condition in this video. The condition wherein patient has got high serum uric acid level and no arthritis. This condition is called as asymptomatic hyperuricemia. It lacks the third component, that is the gouty arthritis. The components of asymptomatic hyperuricemia are elevated serum uric acid levels and metabolic syndrome, which has got hypertension, diabetes, obesity, and hypertriglyceridemia and hypercholesterolemia as a component of it. If the patient has got hyperuricemia and the crystals are already formed in the joints, it has to be engulfed by the macrophages to produce systemic inflammation and local inflammation. If the crystals are coated by anti-inflammatory substances, then macrophages cannot engulf the MSC crystals, that is monosodium urate crystals, and it cannot produce severe local and systemic inflammation. In patients with asymptomatic hyperuricemia, MSC crystals are coated with substance inhibiting the inflammation. So macrophages cannot engulf MSC crystals and produce severe local and systemic inflammation. In patients with hyperuricemia and gout, the MSC crystals will be coated by substances which promotes inflammation. So macrophages can engulf the MSC crystals and they can produce severe local and systemic inflammation. Now, if there is a gouty attack, it will terminate itself by at the end of 24 hours. This is because at the end of 24 hours, the cell population changes. The first cells which comes into the picture are immature macrophages, which will aggressively engulf the MSC crystals and produce inflammatory mediators, which will produce both the severe local and systemic inflammation. At the end of 24 hours, the cell population will be replaced by mature macrophages, which won't engulf the MSC crystals. So, the subsequent inflammation will be aborted. This is the basis of gout being terminated at the end of 24 hours. To manage asymptomatic hyperuricemia, the patient has to maintain ideal BMI, that is body mass index, and the diet in asymptomatic hyperuricemia is not as aggressive as symptomatic hyperuricemia. They can avoid red meat, organ meat, seafood, milk and milk products, and cauliflower and cabbage just to maintain ideal body mass index. They may not go for an aggressive diet as in gouty arthritis. And if the patient maintains the ideal BMI, it will bring down hyperuricemia as well as it will help in control the blood cholesterol levels, sugar levels, and hypertension as well. As a rheumatologist, I will also look into hidden areas of psoriasis in the patient's body, that is on the scalp, behind the ears, below the breast, around the umbilicus, in the inguinal area, in the groins, as well as in the natal clefts, and below the knee, palms, and the soles, to look for skin psoriasis and scalp psoriasis. And if they are present, I will treat the patient for skin psoriasis with methotrexate and local applications. So this will bring down the level of serum uric acid. Apart from that, I have not read a convincing literature that hyperuricemia in isolation is linked to increased cardiovascular morbidity and mortality. It is the associated metabolic syndrome with hyperuricemia which produces increased death due to cardiovascular events. So, when we manage the patient, we have to provide a comprehensive care. We have to manage hyperuricemia, obesity, hypertension, and diabetes. Hope this will help you in managing asymptomatic hyperuricemia as well as for the patient to live with asymptomatic hyperuricemia. Thank you one and all.